us here for E911 planning for Cisco. My name is Kevin Keto. I am the Director of Sales Development here at 911 ETC. And we also have Michael Anderson on the phone with us as well. He's the National Sales Director here at 911 ETC. I'm going to go through a brief agenda here. So pretty much we're just going to talk about E911 as an overview just to make sure everybody is on the same page. We're going to talk about Cisco Emergency Responder for discovery and also on-site notification, and also configuring ELANs and ERLs, and then what type of level of discovery are you going to be doing? Subnet level, switch port level, we'll get into more detail as we go along. And then another really important part to consider is how are you going to be delivering calls? Is it going to be SIP, PRI, or some other type of call delivery method? And then finally, we're going to talk about the NENA model legislation and also state legislation updates, and we'll end it with questions and answers. If you have any questions, please feel free to type them into the chat bar on the right-hand side, and we will address all of the questions at the end of the webinar. With that said, I am going to be turning this over to Mike Anderson to just talk about what is E911. Mike.
Thanks, Kevin. So basically, I apologize. This is a part of the series, so some of you might have already been on some of these calls, so I apologize if I'm going over the same information, but there are some people that weren't at the last one of the series. So basically what E911 is when you dial 911 behind a phone system, generally the only information that is presented to the PSAP is just your main billing address, unless you have gone into the 911 database or the ALI database and populated locations to all your phone numbers. So basically what happens is that a phone number is delivered to the PSAP or the public safety answer point, and they see what is associated. They dip into the ALI database and see what's associated with that phone number. So some of the things to look at in terms of what you must make sure that you do when planning for E911 is obviously provide the correct location information for your phone numbers into the ALI database. On top of it, you have to ensure that you're routing the calls to the correct public safety answer point or PSAP. We've had customers that come to us that have implemented SIP, and in some cases the call doesn't even get to the right PSAP, but especially in a consolidated and extended environment where you have a core data center and locations hanging off of it, you want those calls to go to the PSAP nearest to where the calls originated and not nearest to where the phone system resides. So you have to have a way to get that call to the proper PSAP. Another thing that we find is very important, and a lot of first responders say is very important, is on-site notification. If you do, in fact, have people there that can respond internally and be waiting at the front door or at the gate to assist and escort people to that actual emergency, really speeds up the response times. And then lastly, there are E911 legislations in certain states, and you have to make sure that you comply with those particular requirements. Unfortunately, from state to state, the laws do differ. Next slide, Kevin. So what a lot of our customers do, especially in a Cisco environment, is we set up what we call ELANs and ERLs. An ELAN is just an emergency location, basically a phone number, 10-digit valid BID. And an ERL is an emergency response location. So the way it looks on a diagram or in a hypothetical environment, the next slide, Kevin. So if you look here, this particular hypothetical situation, we have two floors here, and you could have all these phone numbers, all these phones on these two floors. But generally, our customers break them up into zones or ERLs, emergency response locations. In this particular diagram, there would be 4 emergency response locations. East and west on the first floor, east and west on the second floor. Next slide, Kevin. So in this particular hypothetical environment, this customer assigned a unique phone number to this first floor west wing and a unique phone number to the first floor east wing, and so on the second floor. So if someone picks up their phone on the second floor, moves to the first floor and on the east wing, the phone system or the Cisco Call Manager or the CER product, which I'll get into here in a moment, will know that you've now moved to the first floor, and it will send out the unique ELAN that correlates to that location. During the implementation of E911, you will take that ELAN and the location, the address, first floor, east wing, and populate that into the ALI database. So once you set up the ELANs and ERLs, It's very easy. You don't have to continuously update the 911 database. It's just updating the phone. The CER is updating the call manager to know which ELIN needs to be sent out for the location that person dialing 911 is located at that particular time. So it's very easy once you implement this in terms of management. Everything's done automatically with CER within the call manager. Sorry, I just want to let it. So in a lot of cases, the routing of the 911 calls that I mentioned earlier, a lot of our customers are coming to us and they're consolidating everything into a core data center or a couple core data centers. In this particular environment, this person has a core in Portland, Oregon, and one in Atlanta, Georgia. And they can have all these locations in New York, Cleveland, Chicago, Vancouver, Canada, San Diego, wherever it might be. And they can route those calls to our voice positioning center, and we will push those calls back into the appropriate PSAP where those calls originated. This also eliminates the need to contract with the carriers in every region that you might have phones to establish or get access to the 911 database. We used to do what we call PS Alley, stands for Private Switch Automatic Location Identification. And you have to set up these PS Alley agreements in every single state where you had phones to get access to that particular 911 database. With our VPC database, it's one centralized database. You only have to log in and upload into one database. And it's we can do centralized routing as well, meaning that you can just push all your 911 calls to us, and we will route those calls to the appropriate PSAP. So in some cases, we can eliminate, remote gateways, POTS lines. Had one customer, a healthcare organization, who had tons of clinics just hanging off their core hospitals, and to go out and put POTS lines at each site, that starts adding up quite, quickly. Whereas opposed, they can give us one phone number for that clinic and the location, and we'll route that to the appropriate PSAP nearest to that clinic and give them the proper location information. So the way this all works, and this shows a diagram of how the data really flows, and it shows that obviously we can cover remote offices, as I just mentioned. We can cover home workers and soft phone users as well that are highly mobile. But in this particular instance, this user is, we would take the information from Cisco Emergency Responder, and you can actually export a file directly out of their a NINA2 file and ask for, what kind of NINA2 file do you want, and we can walk the customers through that. But basically, you can export that file directly to us. We will take that information and populate the ELIN and URL information into our voice positioning center. So once that information is populated, the only time we really, like I said, we have to update the 911 database is if you had a brand new URL or physical location that you want to add to the database. So there's nothing to really update once you implement this, like I said, unless you add new location. So we have the information in our voice positioning center. We have the ELIN and we have the URL. Someone moves, to the building 4, second floor, room 221, and we assigned a unique ELIN, this 555-1234 number to it. The Cisco Emergency Responder will detect that they've moved, and they will update and say, okay, they're now on the second floor in this area of building 4, which we've assigned this 555-1234 number to. And the reason why we push Cisco Emergency Responder, and a lot of our large customers use CER, is because, well, first of all, we didn't want to compete with Cisco's product, and secondly, we found that the other solutions generally are in the call path. And that presents a big, big problem in the event of a failure. So the CER is not in the call path. It works just fine. It's an inherent product, manufactured by Cisco, and we've had very good success with it. And in fact, Kevin, who's on this call, actually had a customer who did have a different solution that was in the call path. And Kevin, can you maybe add a little bit more information about what the challenge was and what maybe happened in that particular scenario?
Yeah, definitely. There was a customer that I was working with, who's kind of a medium-sized bank in the southern part of the United States, and they had Cisco Call Manager, and they had a competing solution to 911 ETCs. And like Mike said, this piece of equipment that was kind of the competing product for Cisco Emergency Responder sits in the call path, and for whatever reason, when that call, when the 911 call went out, there was one of their branches was actually getting robbed. One of the people dialed 911. It went out Cisco, and then it went to the secondary piece of equipment that was supposed to be doing the ELIN conversion. That piece of equipment was down, and the failover didn't happen. And so you can imagine, making a 911 call, you wanted to go out. They didn't realize that it wasn't working until after the call was made. So that's the biggest reason why we really push customers to go to Cisco Emergency Responder, and now why we haven't developed a product that really competes with it or as an alternative to Cisco Emergency Responder.
Thanks, Kevin. So as I just mentioned, the CER is detecting the movement of the IP phones and automatically updates to say, okay, I have to send out this particular ELIN for this location that I'm now in. That call will then be routed to our voice positioning center. It can come to us over a PRI, or it can come to us via SIP. We do prefer SIP, but we can do either. We can implement doing PRI and convert over to SIP when you have that capability. But basically, that call will come to us via SIP, and since we have that ELIN provisioned in our database, the 555-1234 number, we're going to know which PSAP to send that to. In this particular instance, it's going to be the PSAP nearest to where the phone system is, if this particular ELIN is right at the core. So that call will be delivered to what we call a selective router, which basically covers a geographic area and numerous PSAPs within it. And that selective router then will send that call to the appropriate PSAP nearest to where the call originated. The PSAP system is going to get that ELIN, the 555-1234 number. They're going to dip into the ALI database, and whatever we populated as to that location is where they're going to respond. So it's actually quite simple, not a whole lot of moving parts. In this particular solution, there's no equipment, software, hardware required other than the Cisco Emergency Responder product. Another neat thing about the VPC solution, though, is that now we can, in the past, that old PSALI solution that I mentioned earlier, when we'd send an update to them, they wouldn't guarantee that shows up or posts till 24 hours later. So to try to cover a highly mobile softphone user is pointless, because by the time you provision in the database, they might have moved again. And another thing I mentioned is that in the past with PSL, you'd have to have local trunks to get into the selective router everywhere where you had phones. So to get remote offices or people VPNing in from home, if they're in a different area that's covered by a different selective router, that won't work. Because they would dial 911, it will hit the phone system, it goes to the selective router and goes to the PSAP nearest to where the phone system is, not to the PSAP nearest to where the home office is. Because it can be a totally different selective router that services this particular user as opposed to where the call manager resides. So in this particular case, we would just provision this person's VPN hard phone number into our database. And if they go into the office, the ELIN that we've assigned the location will come. But if they're working from home, we get their actual DID. That call will be sent to us. Since we have it provisioned in our database, we will send it to the appropriate PSAP nearest to where their home is, and they'll do the dip and get, somewhere else, California. So wherever that person might reside. Or highly mobile user, they can provision their location and go anywhere in Canada or the United States. Lastly, in the event that we get a 911 call, and that call we do not have provision, let's say a customer chose to implement E911, but they decided, we only have a handful of soft phones out there, and we don't need to cover them. And in the event one of them dialed 911, you sent that call to us, we wouldn't have that phone number provisioned in our database. So what do we do with it? Do we terminate the call? No, it's a 911 call. So we actually have to send it to what we call an emergency call center. They're all APCO trained, 911 call professionals. They answer the call, and then they ask that person where they're located. And once they get that information, they have the ability to transfer that call into the correct PSAP nearest to where the call originated. So it's not perfect, obviously. If that person cannot speak, they are out of luck. But we have to have this in the event that something goes wrong and we get a 911 call from a phone number that's not provisioned in the database. Another likely scenario is maybe you implemented E911 and added a brand new location and forgot to tell us about it, and you sent a 911 call to us. We would have to send it to that emergency call center, which would then have to ask that person where they're located and transfer it to the proper PSAP. It's just basically another level, basically insurance. In the event something goes wrong, we're still going to be able to get that call to a PSAP operator, and they'll be able to transfer it to the correct PSAP. So these are some of the guidelines for MLTS, and this is based on the National Emergency Number Association and the model legislation they put forth. Unfortunately, like I said, all the states are not uniform in terms of their legislation or their laws. But NENA kind of put this out there as some guidance for the states. First of all, some of you probably have heard of Carey's Law, which was an incident where a young girl tried dialing 911 from a hotel room while a domestic assault was happening between her parents. And this particular hotel made you dial 911, and she wasn't aware of that. She kept dialing 911 and got a fast busy every time. Unfortunately, her mom perished, and so now that got a lot of visibility out there in the marketplace. And I know hospitality groups really took care of that issue, but I like to let everybody know that you should be able to dial any kind of iteration of 911, 911 or 911, whatever it might be, because if you're in a panic, you're not going to necessarily, or if you have a visitor on site that picks up the phone and dials 911, they don't know what your policies and procedures are. You should allow all your company phones to call 911. I've heard of some instances where customers will not allow them to. That creates a lot of liability for the customer and the person who dials 911 or is trying to dial 911. You should also ensure that you're delivering precise, accurate location information, of course, which is pretty much without saying. On-site notification, as I mentioned earlier, it makes things so much easier for those first responders if they have someone waiting for them and who knows your environment and your buildings and can get them there a lot quicker. And no local termination of 911 calls, meaning you don't terminate those calls just locally. You have to get that call to the proper PSAP. And then you should also make test calls twice per year, just to ensure everything is working as it should. One of the cool things that we can do if you're sending the calls to us via SIP is that if you want to test, sometimes in certain cities they make you schedule times that are very difficult, like in the middle of the night, like in New York City, like between 2 and 4 in the morning. So in the event you want to just test and go to a bunch of different locations and test real quickly, we can allow you to test to 933. You send your calls to 933, and it'll actually do an audio recording readback of the phone number they're getting and the location that's provisioned. It's accessing the same alley database that the PSAP is. So if 933 works, you know it's working just fine. I did touch on legislation briefly, but there are currently 18 states with E911 legislation. California and Ohio are coming. But if you look on this map, everything in red has some sort of legislation in place. The ones in light blue, there's really nothing going on. And the ones in dark blue, there's pending legislation. You can go to our website at www.911etc.com/legislation. You can click on the states, pull up the actual legislation or just a little synopsis of what it is. Like, for instance, in Washington State, it's 25,000 square feet or per floor, meaning each ERL, emergency response location, has to be 25,000 square feet or less. So, and if you have a 2-story building, you have to break it out into each floor. So if you had a 30,000 square foot building, you'd have to break it up into north-south or east and west. Some of our larger enterprise customers have actually standardized on what the most stringent legislation, other than Florida, and Florida's kind of an outlier, but Virginia and Michigan are going to 7,000 square feet. So what some of our enterprise customers are doing is doing everything. Every ERL, no matter what state, is going to be 7,000 square feet. Others just meet the minimum requirements of each state, but that's something that you probably want to talk to legal. We can provide some assistance, but definitely something you want to run by your legal group and get the sign-off from them as well, because believe it or not, different attorneys interpret things differently. So we have one customer who says, my attorneys say we got to do it this way, and another customer's attorney says they got to do it this way. So, we're not attorneys. We definitely like to get some input from the legal representation. So really, in a nutshell, I hate to make it sound so simple, but it really is. We got a lot of customers that come to us and say, gosh, that was really simple. But that's what we try to do. Not a lot of moving parts. There's no software other than if you wanted to cover your soft phone users. But in terms of the actual implementation, there's no software, hardware, or anything required on site. You're just routing the call through one centralized source. We don't have to deal with the telcos. We don't have to pay them fees for PS Alley access. So it makes it very easy. It's one-stop shop. You don't have to deal with other companies to get this implemented. And it is actually quite simple, and especially once you implement it, as I mentioned earlier, there's nothing to really update other than if you had a brand new location. Now, I'm sure it probably brought a lot of questions. I know our last webinar had quite a few of them. So if anybody has any questions, you can go ahead and fire away. And Kevin, you just want to read those off, and I'll answer what I can.
Sure. Yeah. So the first question I have here is there a difference between sending calls via SIP or PRI?
Well, first of all, you can't test the 933 if you're doing PRI delivery. The other just drawback to doing PRI delivery, and this is something that doesn't happen too frequently, but what we have to do is provide an access phone number. So for PRI delivery, we're just giving you generally an 800 number that you're going to call forward all 911 calls to, so it can get to us. But if somehow someone misdials a phone number and actually happens to dial your access number, that call will come to us as an unprovisioned call. And, we don't know, it could be a soft phone user, it could be whatever, so we have to send that to the emergency call center. So that's just the one big drawback, and we actually we get charged every time we send a call to the emergency call center, and we pass that along to our customers. We used to charge for every occurrence. Now we do a little bit different way of pricing it out, where we give you X amount per quarter for a flat fee per year, and generally our customers don't go over that amount. And so you're also notified when we get an unprovisioned call. So anytime an unprovisioned call occurs, you get an email notification, whoever you want us to notify, saying, hey, we just had an unprovisioned call from this phone number at this time. So you can go in and figure out, what did we do wrong? Uh-oh, we added a new location, forgot to tell them, or whatever it might be. So that's the only really big drawback for PRI delivery. But we do have some very large customers still sending us calls over PRI.
Cool, thank you. Next one is, how does 911 callback work if you send a DID other than what's on the originating endpoint? So I guess basically, since we're the customer be sending out the ELIN, how does that call get routed back to the person who dialed 911?
Great question. So when we deliver an ELIN to the PSAP, if they dial back that ELIN, the call manager and the CER will hold that in a queue, and actually, if you call back that ELIN, it'll actually route it back to the last 911 caller's DID or extension. So that's all done within the call manager and Cisco Emergency Responder.
Cool. All right, the next one is, if a company had several hundred sites, how would they go about testing 911 across the U.S.? Is there an available listing of the PSAPs so they can be contacted prior to testing?
Actually, yes. We're doing a very large implementation. It's going to take a couple of years with thousands of locations for a very large financial institution. And we actually will reach out to the PSAP, get them the contact information, which is sometimes kind of difficult, but we have an operations group. There's a great group of people that work in it that have been doing this. Some of them have been doing it 15 years. So they kind of know the ins and outs. And they reach out to each PSAP when they want to do testing. And in this particular case, some of their sites are only PRI, so they can't do 933 testing. But where we have the PRI, so where we're doing the PRI delivery, they'll reach out to the PSAP, get the contact information, and provide that to the customer, so the customer can then just reach out and schedule the time, send an email saying what would be best for you for us to test our 911. Some PSAPs don't care. They're like, do it whenever you want. But larger cities generally want you to call and schedule a time.
Yeah, and I also want to piggyback on that, Mike, that we can do the 933 test calls. If the customers are delivering the calls to us via SIP, they can actually do 933 test calls. So that actually call wouldn't even actually go to the PSAP. It would go to a PSAP simulator where the phone number will be read back and the location information will be read back. So that's what a lot of customers will do as the primary method of testing.
Yeah. Next
question is, it's really basically, there's two questions that are fairly similar. It's just asking about international phone locations. Do we have, what about coverage in Australia, Brazil, Europe, and Asia?
Well, I will say that something that we are working towards right now is the EU and the UK. I think Australia might be after that, but I don't think that Asia and Latin America have the infrastructure or capabilities. I know the EU, they're finally getting their act together, because in the past it was, they had one phone number for ambulance, one phone number for fire, one phone number for police. So we are actually actively pursuing and looking at that, because we do have some very large international customers that are looking to implement E911 in other countries. So I don't know, I can't give you a firm time frame, but I know it's coming.
Next question is, does CER work with PBXs from other vendors, for example, Avaya?
No. So that's kind of the difference between Avaya and Cisco. Avaya allowed their partners to develop their own E911 IP discovery and notification. Cisco has their own homegrown solution. And the way they differ a little bit is Avaya actually has the capabilities already within the CM, or what they call it, the communications manager, that allows you to identify ELINs per subnet. So you basically assign a unique ELIN to every subnet. And that's actually what Cisco does, but you have to have the CER software to enable that functionality, whereas Avaya, it already comes with it in the box, basically.
Okay.
But
next question is, go ahead.
I was going to add to it, but if your subnet, some customers have subnets that span multiple floors or buildings, they don't want to reconfigure their network, there is software solution that we can provide that does IP discovery on the Avaya.
Cool. What's the recommended solution for environments with multiple PBXs from different vendors? For example, Cisco, Avaya, maybe possibly even Link.
That's a great question. We have many customers that are in that exact scenario. That one that I mentioned we're doing thousands of locations for over a course of 3 years, they have Cisco, Avaya, and Skype for Business. So really, to be honest, we would take the ELINs and URLs from CER. We take the ELINs and URLs out of the Avaya system, which you can do via subnet, like I mentioned, or we do have software that will actually update the CM to say, okay, now this person's at this location, send out this ELIN. And Skype for Business actually has that capability built into it as well, which allows you to identify ELINs per subnet. So we just take all the ELIN and URL information, we provision our VPC database, and they route all 911 calls from the 3 different phone systems to us, and we would push them into the proper PSAP. I mean, we have a handful of customers that basically that exact scenario exists.
Great. There's actually 3 questions, all in regards to testing. One of them is talking about could a company get into legal trouble if they're doing 911 testing to PSAPs if they were not notified ahead of time. Follow-up is, what is 933? And then also, how can a PSAP listing be accessed so they can be called ahead of time, especially if 933 is not in place? And actually, I'll address that last one. We'll actually do that for our customers ahead of time if they need that. We can either give them the list of the phone numbers of the locations that they want to be testing, or sometimes, if we need to, we can actually even set up a time on behalf of the customer to say, hey, we have a customer that wants to test. When is the best time to test? And we can find out what the test procedures are for that particular PSAP. And then, Mike, if you want to answer the other 2 about the legality of testing the 911 without notifying them ahead of time, and then expand a little bit more on what 933 is.
Sure. So legally, no. You wouldn't. I mean, you wouldn't get any. I mean, you might get your hand slapped or get yelled at, but you're not going to get any legal trouble. Because generally, I mean, you're trying to help the PSAP by giving them better information, so you need to test it. So it's just that in some cities, they get very testy if you do not, contact them beforehand and schedule a time. And to piggyback on top of what Kevin just said real quick, and I'll address 923, is I remember 14 years ago or whatever, when I started this, I remember trying to find who we contact, at the PSAP in order to test. And you basically have to go to the county website, you find the 911 department, and then you call the administrative line, you try to find the right person. It's not the easiest thing in the world, but it can be done. And then for 933, really what that is, as Kevin said, basically it's a PSAP simulator or a public safety answer point. It's basically accessing the same ALI database that the PSAP does. So when you call 933 and you're sending the call to us via SIP, we'll send it to that PSAP simulator, which will then audio readback or recording will say, I got this phone number and I have this location associated with it. So if that comes back accurate, we know it's going to work. We've never had a situation where we tested the 933 and it worked, and then we did actual live testing of the PSAP and it didn't.
Okay. A couple more questions here. We are in Florida, and the legislation says desktop-level location info needs to be given. Can your solution provide that level of granularity?
Yeah, most definitely. It does take a little bit more work with CER to get down to the desktop. It's not the easiest way to deploy it. But we do have customers in Florida who have CER and Cisco and have gotten it down to the desktop. Now, that legislation is kind of funny because it says you must be able to get to the desktop. And I do have customers in Florida who say, well, I can get to the desktop, but I'm not going to. That's, you know, telling someone that I'm in cubicle 10A, that's not going to tell them much information. But, you know, that's like a legal question too, though. But a lot of our customers do interpret it to say we will get down to the desktop, and yes, it can be done.
Okay. Next one here, let's see. I have CER already. Why do I need 911 ETC?
Well, to get access to the 911 database, first of all, for, you know, like, for instance, one of our larger customers has sites in about 30 states. They looked at doing everything themselves and getting access to the 911 database in every state where they're located. That was going to cost them almost 6 figures just to get a login and password for every state that they're in. And that's not for, you know, the telco's not doing anything other than saying, here's your login and password. You can go in and load all your information into our database, but we're going to charge you, you know, it depends on Del South, it could be as much as $9,000 for access, and in Verizon it's $2,550. And in some cases, they want to charge you for every phone number that you own on a monthly basis. And that's a big differentiator between us and some other people out there, is that we only charge for the ELINs and EARLs. So you might have 10,000 phones, but you might have 500 ELINs and EARLs. That's all you're paying us for. But if you do this yourself and you contract with the carrier for PS Alley, they want all of your phones in their database. And they'll tell you, well, that's just in case something goes wrong and you send us a phone number that's, you know, that's not an ELIN that's provisioned in the database. No, what they really want is, you know, they're 5 cents a month for every phone number that you own on a monthly basis. And they're not doing anything with those phone numbers. So you can certainly do it yourself. It's going to cost more. And then lastly, you're going to have to put in local gateways and PRIs everywhere you have physical phones, and that includes, you know, VPN workers, soft phone users, everything, because you have to have a way to get that call into the proper PSAP. And now some people come to me and say, well, hey, Mike, we're moving to SIP, and our SIP provider says we can do all this for you. And they implement it, and they find out, wait a minute, they can only get us to the address. Then they call me in a panic, oh, gosh, I guess we do need you. Because we found that the SIP providers, yeah, they can do 911. They'll get you to the address. But if you want to get to the floor, or, you know, you have to get more granular in a lot of these states than just the address, that's not going to work. So, in fact, we work with Verizon to provide E911 for their customers in the D.C. metro area where they're replacing Centrex. So, just because you're going to SIP and your SIP provider says, oh, yeah, we can do everything, you might want to make sure of that, because we found that most of the major SIP carriers will not. They'll just get you to an address.
Great. And there's another question here. I'm not going to read the entire thing, but just basically the gist of it. It's basically asking about soft phones, and if somebody had a soft phone and they were using like Verizon's LTE, 4G coverage, and they were using a soft phone and they, connected VPN back to their hub, how would we get the right location information and the right, it routed to the right PSAP?
Well, we have some software that basically, that's a client that you load on the soft phone, and it allows a user to provision their location. Basically, what it does is it pulls the NAT and IP address that soft phone's connected to, and if that changes, we know they've moved their soft phone. Up will come a prompt saying, hey, you moved your phone. Can you please give us your new location? And you as an administrator can actually restrict the usage of that soft phone until they put in a valid location. So if someone tries ignoring that prompt and says, it's not important, you can make it so they can't even use the phone until they go in and put a valid address. And so once they put in that valid address, that automatically updates our VPC database. So when they dial 911, it comes to us. We have that phone number provisioned in our database. We know which PSAP to send it to.
Great. All right, next thing is, do you sell CER?
No, we don't, but I do know of plenty of part resellers that do. So if you need any assistance in finding somebody, I can certainly help you out with that.
Yeah, I think that's kind of an important point. We're not, making anything off of this. We just feel like it's the best possible solution for customers that have Cisco. So it's not like we are able to make margin off of it or anything like that. We really just think it's the best solution for customers, especially in situations where you're getting in the call path. We don't really want that to happen. Next thing is we have an office in Naples, Florida that is connected via VPN tunnel, and they have a local Comcast voice. They use our Cisco call manager for internal calls, and we have CER, where your product provides the correct location information when 911 is called. Local calls route through the Comcast local connection.
I needed a little bit more information about it.
Yeah, I think that Dave, you know what, Dave, we'll probably actually call you after the webinar's over to talk a little bit more about this. So we'll definitely be calling you right after the webinar's over. Yeah.
My initial thought was yes, but I need more information before I say yes.
Yeah. Yeah, we'll call you right after the thing's over, Dave. All right, if there's no other questions, I think we can wrap this up. I'll wait here another maybe 30 seconds or so I'll get our information up on the screen. If you wanted to email either Mike or myself or give us a call, please feel free to do that. We can definitely answer questions offline, and we will be contacting pretty much everybody who has been on the webinar to answer any specific questions that you may have and follow up just to make sure that we answered all the questions that you had done. And other than that, I think we can conclude. Yeah.
And there will be a link for a recording of this whole presentation. If someone would like a copy of it, just let us know.
Yep. All righty. Well, thanks everybody for joining our webinar on planning for E911 for Cisco environment.
Thanks everybody.